While this film was being made, the Yom Kippur War broke out. October 6, 1973, 2 o'clock in the afternoon. Israel was being attacked in Sinai and on the Golan Heights. Once again, Tel HaShomer became an army emergency center. To make room for the wounded, most of the 1,000 patients at Tel HaShomer had to be sent home immediately. Doctors rushed back from their synagogues to make out full medical reports for every patient to take home, along with a 3-day supply of medication. Already the mobilization had called most of our doctors and surgical nurses. Working with doctors from all over the country under heavy artillery and missile fire, they set up field hospitals and tended the wounded. Tel HaShomer would soon be receiving an extraordinary number of emergency surgical cases. So the kidney transplant unit was converted to a burn surgery unit. Civilian wards were quickly transformed into military wards. The dermatological ward was prepared for orthopedic patients. Internal medicine wards were prepared for surgical cases. Only 300 of the most critical civilian patients were kept in the hospital. Doctors made last-minute rounds because they would soon have to leave their wards to take care of the wounded. These barracks, always on alert as emergency rooms for a major crisis, were ready for immediate action. The Brit Milah Hall was converted to another emergency room, waiting, just in case the number of wounded exceeded the number that could be handled in the old barracks. On the battlefields, our doctors sometimes had to perform emergency life-saving operations, even before the wounded were rushed to the major hospitals in the heart of the country. At Tel HaShomer, we were ready and waiting. As the casualties arrived, doctors rushed to the helicopter and decided which soldiers were the most critically injured. These were taken out first. Our top specialists were waiting in the emergency rooms, which were manned round the clock by a full staff. Within a few short minutes, they carefully examined each soldier, x-rayed him, typed and analyzed his blood, checked and changed his infusions and transfusions, and decided whether an operation was needed. If it was, the patient was on his way immediately. Doctors from the United States, from South Africa, from Europe, came and volunteered their services as soon as the battle began. For another battle was being fought, a battle to save human lives. Complications had to be treated. Infection, hemorrhages, malfunctioning of the kidneys or respiratory system. All of the hospital's medical skill and all of our equipment were needed to meet the crisis. But not all complications were physical. Many were emotional. When a boy loses his arm or his eyesight or his ability to walk, the shock is tremendous. Medical skill and modern equipment are not enough. Call it devotion, caring, love. This is the vital ingredient in the relationship between doctor, nurse, and patient that gives a badly wounded boy the will to live. Another crisis is the first sight of a wounded son, brother, or husband in a hospital bed, perhaps disabled for life. To cushion the shock to the soldier's family, the hospital set up a special unit of social workers to greet them at the gate and to prepare them for the emotional trauma. The entire nation cared deeply about the wounded soldiers. Volunteers poured in from all walks of life. Housewives left their homes to lend an experienced hand. Businessmen closed their offices to take on jobs they had never dreamed of doing. High school students volunteered to do whatever was necessary. All were eager to contribute wholeheartedly in any way they could. From outside Israel, volunteers came to show that they too cared. Volunteers like Isaac Stern, who gave generously of his time and talent. And those who could not come sent gifts and flowers, so many that they filled an entire pavilion. A pavilion whose doctors and nurses had been taken away to minister to the casualties of the war. In peacetime, this is the Cardiac Rehabilitation Institute, where men who have suffered heart attacks are participating in a lifelong program of rehabilitation. This group of men can look forward to lives with less dependence on drugs, fewer heart pains. Fears and frustrations will be replaced by renewed self-confidence. Their work capacity will increase. Their life expectancy will be prolonged. But emergency treatment of the wounded took precedence over our peacetime work. One of the greatest emergencies during the war was the treatment of severe burns. Fast, proper medical care was needed to keep a badly burned soldier from dying or being disfigured for life. With the same dedication that characterized his treatment of burned soldiers during the war, Dr. Haggai Tzur was trying to find a better way to treat burns before the war. Excess bleeding is a problem in skin grafts. A certain hormone was generally thought to reduce bleeding. Dr. Tzur had to operate on hundreds of rabbits and carefully measure their blood loss in order to prove this theory correct. November 15th, 1973. The first sign that peace might come to our country. 26 of our wounded prisoners had just been released by Egypt. The tension was almost unbearable as parents, wives, brothers, and sisters waited for the boys to arrive at Tel HaShomer. And then, they knew they were finally home. And their families and friends and total strangers wept with joy and relief. 42 wounded prisoners came back that week, and every one was taken straight to Tel HaShomer. As the weeks passed, our soldiers made speedy recoveries. We treated 1,300 boys who had been wounded in the Yom Kipur War. We started a new surgery unit to reconstruct hands, a plastic surgery unit for faces that were damaged by burns. We treated ear defects due to shelling and gave psychiatric treatment to soldiers with shell shock. Most of the wounded were soon ready to go home and start building their futures. But for some, their futures will be in our hands for a long time. These boys who sustained spinal injuries in the Yom Kippur War will never walk again. Our job is to give them a new life. It will take a long time. After the first acute stage of their injuries has been overcome, we must help them to become rehabilitated mentally and socially. To keep up with their studies. To train their muscles to move again. We built a new spinal injury center. And now we are bringing in the best rehabilitation specialists and the best equipment we can get, so that we can give them the best opportunity for a successful rehabilitation. Since the War of Independence, we have been rehabilitating crippled men, women, and children. The Rehabilitation Center provides every medical specialty and rehabilitative service that these patients need from the time they are injured until they are successfully rehabilitated. Our patients include soldiers, children with congenital deformities, and victims of accidents on the highways, at work, and at home. Some must learn to do the simplest things all over again. Some must find new interests in life. But it is not only a patient's body that needs rehabilitation. We restore his spirit as well, as Dr. Shiba did when he sat for hours with patients who had lost the will to go on. Dr. Shiba never stopped working to make Tel HaShomer what he knew a hospital must be. He died at his work on June 10th, 1971. But he made sure that capable young doctors were given every opportunity to grow, so that there would always be qualified leadership to take over the hospital in the years to come. For as modern medicine grows, so must our hospital. And in a few years, our new complex of 14 buildings will give us 800 more beds. We will have room for more equipment, more clinics, more laboratories. Then we will have a total of 2,000 beds to help us take care of Israel's growing population. This is the future of our medical center. We have come a long way since the day in 1948, when Dr. Shiba stood in a field of rundown barracks and looked into the future. For Dr. Shiba's lifelong dedication to Tel HaShomer, we have renamed our hospital in his memory, the Chaim Shiba Medical Center.